The procedure demonstrated here would be a transperineal prostate biopsy, also known as TP biopsy. Here, a BK5000 biplanar probe is used, and the basic requirement of the biopsy procedure is confirmed. A Civco table mount taper is used along with a brachy grid. Here you can see the complete assembly of Civco taper. Patient is given a lithotomy position. The first part of the table mount of Civco taper is connected. The second part is connected, which has got an articulating arm, and that will be controlled by the surgeon. The third part is a mechanical connector, which allows the ultrasound probe to have the fine movement while doing the biopsy. The biplanar probe of the ultrasound is placed and mounted on the mechanical driver of the stepper. The entire working assembly of the stepper and the probe is covered with a sterile plastic sheet. The biopsy or the brachytherapy grid is mounted and locked so that it will not have any wobbly movement. The procedure is done under general anesthesia so as to avoid any inadvertent movements of patient's body during the biopsy. Perineum needs to be cleaned with an antiseptic solution, and there is no need of draping the entire pelvis of the patient. I prefer to give one dose of intravenous antibiotic for gram-positive cover. The ultrasound probe is inserted transrectally, and in real-time imaging, stepper is positioned and fixed at the mid-gland level of prostate. Once the stepper has been completely immobilized, the biopsy grid is tightly slid against patient's perineum and fixed with the adjustable screw. Here you can see I am trying to minimize the gap between the biopsy grid and the skin of the perineum. In ideal situation, the probe should be perpendicular to patient's perineum and the grid should make a 90-degree angle with the probe. After ensuring the probe position, endocavity balloon is inflated by using 10 ml of normal saline to stabilize the prostate and to attain slight anterior deflection of prostate as well. I prefer to use a dual live plane mode, which provides a real-time biopsy needle entry in sagittal plane and simultaneous axial plane. Once the needle guide option has been chosen on the keypad of the ultrasound, you would be able to demonstrate the dual plane and the brachy grid. Using the micro touch movement on the stepper, we would be able to scan the entire length of the prostate from base to the apex. For biopsy purpose, the needle is mapped in sagittal plane, which gives an excellent view of depth and angle of the needle entry. There are different ways of collecting the biopsy specimen, either wiping the needle carefully on a piece of paper. Here, I have used the traditional way of delivering the biopsy core directly into a formalin solution bottle. After every needle immersion into formalin, the needle tip is rinsed with normal saline solution. My preference is to biopsy two cores from individual regions, namely the base, mid, apex, and far lateral targeting the anterior horn of each lobe, amounting total 16 cores. Additional targeted or anteriorly directed biopsies could be obtained in separate containers. It is always advisable to witness the needle path whilst entering the prostate gland, which is generally not possible if one uses single plane for biopsy. In this video, I have fixed my ultrasound probe at the mid-gland level, where I can see the maximum width of the prostate, and the biopsy is getting obtained from the right mid-lateral area. The biopsy grid technique is extremely helpful to stabilize the prostate and to accurately enter the desired prostate area, and it is more helpful in obtaining targeted biopsies. The learning curve for this procedure is generally between 5 to 10 cases. In this particular video, you can see the needle entering into the anterior horn of the right peripheral zone. That is more appreciable in axial image. The ultrasound probe is maneuvered in a clockwise manner so as to target the left side of the prostate. Once again, I begin my biopsies from left base 2 cores, left mid 2 cores, left apex 2 cores, and left far lateral targeting the anterior horn of peripheral zone. The importance of using a dual plane ultrasound probe is extremely invaluable, especially in obtaining the far lateral or anterior horn biopsies as well as the anterior zone biopsies. A long 1.5 to 2 centimeter length core which looks like a worm is a sign of an adequate core biopsy. A reverse chronology is followed while unprepping the patient. The balloon is deflated and the plastic drape and the endocavity balloon is removed from the probe and the stepper. A simple perineal Gamgee dressing is sufficient and patient is generally discharged on the same day.